national response rate is 64.6%, and the state average is 60%. We here in Dougherty County are lower than the state average and much lower than the national average at 57.8%. For every person who is not counted, Albany and Dougherty County will lose between $20,000 and $30,000 in funding over the next 10 years. Additionally, those communities where the response rate is lowest will not be adequately represented due to being undercounted. Receiving the funding to which we're entitled and representation according to population depends on an accurate census. The deadline for completing the census was originally July 31st. That date was extended to October 31st, but inexplicably was recently shortened to September 30th. This means we have less than 5 weeks to increase our response rate to meet or exceed the national average. Response rates are monitored by census tracts. We know that the lowest response rates here in Albany are in neighborhoods where high percentages of the population live at or below the poverty level. It is essential that we reach out to these neighbors to assure the response rate here in Dougherty County meets or exceeds the national average. Otherwise, we will be underrepresented in Congress and the state legislature. Efforts to bring jobs to our community will be frustrated, and more importantly, we will lose out on the federal funding mentioned earlier. We have a local complete count committee, which is engaging citizens by moving a trailer and station between shopping center parking lots here in town. Pamphlets encouraging customers to complete their responses are being inserted in monthly utility bills. The Department of Community and Economic Development has a program which will provide rent assistance for tenants who complete and return the census form, and Albany Utilities is having a series of drawings with the names selected from the barrel receiving a $500 credit on their utility bill. But we must do more. One strategy that has proven successful throughout the country is engaging trusted voices. The response rate in communities where a large percentage of the population lives at or below the poverty level, among Hispanics and the homeless, depends upon having the public support and participation of individuals who have the confidence of these populations. Obviously, ministers and elected officials should be enlisted to assist in encouraging residents to respond. Materials have been provided to restaurants, grocery stores, and other businesses where most of the clientele speak Spanish. The Census Bureau is working with social service agencies that are active in the homeless community to assure as many of these individuals are counted as possible. All of us can join this effort. Some cities during previous censuses conducted phone trees. Every participant commits to contact 10 other people to encourage them to respond and also to call 10 other people. I'm asking that each of you phone or text 10 people to encourage them to respond, and then to phone or text 10 other people. The low response rate we are seeing is understandable in view of what we have experienced this year. We must, however, take immediate action, as we will otherwise be penalized for our poor response rate for the next decade. The census can be completed online at 2020census.gov. Thank you.
Thank you, Mr. Mayor, for your comments today. And now we will hear from Dougherty County Commission Chair, Mr. Christopher Cohilas. Mr. Chairman.
Thank you, Chief. Thank you, Mayor. Let me begin first by saying I agree with everything the Mayor said, and it is of paramount importance that we do even in these uncertain times, that we make sure that we continue to take care of the business that we have to take care of as a community. It's far, far, far too easy in these uncertain times to forget about the many other responsibilities that we have, either to ourselves, to our neighbors, to other community members, and to our community as a whole. Being counted as part of the census is something that should be really at the forefront of this community's minds, especially given the history of this community, its connection with the civil rights movement, its connection with voting rights, its connection with making sure that everyone is counted. These concepts that are developed through the census by having everyone counted are ones that are very important to this community, and especially given that we are a community that has haves and have-nots, that we have a large number of people that live beneath the poverty line, that we have a large number of people that literally live from paycheck to paycheck, or from welfare check to welfare check, or that live within that sort of environment. That's very important for us as a community to be able to continue to access the resources that we need in order to better our community, in order to be able to get congressional allocations, to be able to get infrastructure dollars. So many decisions are made based upon the number of people that are within a particular community. And let me put it this way as well. Some of the information that literally determines whether or not you actually get help following a natural disaster is driven by your population, and your population is obviously counted by your census. And I say this from having gone to Washington, D.C. after the 2017 disasters and discussing our overall population trends, where people lived, whether or not we met certain requirements. And I will tell you, everything that the mayor said is absolutely correct in how important it is, even in the midst of COVID-19, for us to make sure that every single person is counted, because everyone is important. Every human, every citizen literally determines another series of dollars that can potentially come and help this community. I recognize that to some people this seems like an inconvenience, but consider it as an investment in your community, an investment in making sure that we have a greater voice, and making sure that we have a greater voice not only in Atlanta, but in Washington, D.C., and in making sure that the additional dollars that, and I would remind people, I mean, we're ultimately going to be the beneficiary of a large portion of $64.9 million that is flowing to the state as a result of the 2017 disasters. Many of those decisions and allocations relate directly to our population. And so I think that's very important. And the mayor brought up a really good point in connecting the COVID-19 and this other responsibility, because our other responsibilities don't go away over time. We have to continue to be, the way we define ourselves is not how we shirk and fear from something that we don't know a lot about. It's about how we maintain action in the face of adversity, but we do so very diligently, we do it safely, we do it smartly, and frankly, we've had to do this time and time and time again. We're also coming up on flu season, and I think that that's going to bring about some very important decisions that we're all going to have to make. We're going to have to be extremely diligent during this time, and I would encourage all of our citizens at this time, if you have access, and there are many points of access to flu vaccines, go and get a flu vaccine. And I want you to understand sort of what some of the events or the potentialities are for us and other communities to experience as we come upon flu season. We're going to have, as everyone does, when flu season comes around, people experience symptoms. Many of those symptoms literally mimic COVID-19. And so then that causes a whole nother series of decisions that person has to make, or that employer has to make if they have an employee that has the flu. So in this instance, it is an ounce of prevention is most definitely worth a pound of cure. And we know that we have good, viable flu vaccines. We know that our medical providers and our medical partners have good, reliable protocols to be able to administer those vaccines. I would encourage everyone to go and do that so that we can sort of remove the cloak of uncertainty that many other communities and many other citizens may experience. Because if you can literally get a vaccine for something that mimics COVID-19, imagine the amount of anxiety that you're going to release from the community and how much better off we're going to be. And I don't know about what or whether or not there's even been any studies about whether or not someone can catch COVID-19 as well as the flu at the same time. But at this time, I would have to say this: anything you can do to continue to invest in your own immune system, your own ability to combat any sort of illness that attacks your well-being and your immune system, is ultimately an investment in making yourself more resilient to COVID-19. I do want to talk about some of the numbers, and I think this has been a way that we have really defined ourselves as a community as being transparent in our numbers. I don't have anything terribly exciting to talk about today, and frankly, that's good news. Every time I can get up here and I can give a boring press conference, that's good for our community. As I said before, we absolutely, as did the rest of the country, the rest of the state, and many other communities, did we experience a second resurgence or a second bounce or a second whatever people want to call it. Absolutely. The entire country is experiencing that. Have we continued to exhibit signs that second resurgence is flattening? Yes. We have sort of remained steady in this area right here, which is showed about a total percent positive, about 13%. We've gone anywhere from 11 to 15% over the past 5 weeks. That's good and very important for us, that we don't want to see those huge spikes. And in addition to maintaining sort of a level plateau in this area, the numbers of deaths have continued to stay very, very, very low. Again, the death of any life or any citizen is absolutely too many, but I'm very thankful for the fact that Mr. Fowler, our coroner, is having to visit far fewer families than he was in March, April, and May. And that is a testament to the investment that we have made into this community and the changes that we've made in our culture and how we emote and how we mask up. And I think that's all very good. Again, these are the numbers. They continue to show flattening. I think that's encouraging for us as a community. And we continue to be seen as a leader in how we have responded to horrible circumstances. And frankly, for us to continue to be here where we're at right now versus where we were 4 months ago is it's very awe-inspiring, and I'm very thankful for the hard work of all of the many citizens, all of the citizens, as well as the healthcare workers, EMS workers, first responders, everybody that has contributed to work and attack this remarkable problem that unsheathed itself in our community in an unspeakable fashion. And again, I want to say thank you to everyone. Please stay safe, mask up, and make sure that you're counted.
Thank you, Mr. Chairman, for your report today. We will now hear from our representative from Phoebe Putney Memorial Hospital. Dr. James Black is here. He is the chairman of the emergency department. Dr. Black.
Thank you and good morning. I'll cautiously take off my mask because I'm more than 6 feet from everyone. As you can see on our map and our chart that we're showing, currently we have a total census of 64 patients in our hospital system. The number's up just a tad bit. It's not as good as it was back in June and early July, but certainly not as bad as it was in March, April, and May. We want to do everything we can to try to keep those numbers as low as possible. We also have to report 5 additional deaths since our last report out on Monday, our last public release of our numbers. So we've had 5 additional deaths. So we're in a much better position than we were, but we're not out of the woods, and the disease is still prevalent in our community. So I want to take the opportunity and take the time to reiterate proper usage and proper masking up practices when we're out in the community. You cannot tell easily who has COVID and who doesn't, and the majority of people exhibit little or no symptoms, and no one is walking around with a big C on their chest and they're not coughing and hacking up, but a lot of people still have the illness and have the virus and can transmit it. So again, it's not a purse, and it's not a elbow pad or a bracelet. It's not a chin strap. It's not a headband. It needs to cover your mouth and your nose. And Phoebe will continue to partner with the community to help provide masks for the community. And I believe this Saturday, which is tomorrow, at the Keys building on South Slappy, we'll be distributing masks from 11 a.m. to 2 p.m. So please, if you don't have access to the masks, swing by. We'll provide them. And if you are using a cloth mask, remember to launder them as well, okay? If these are reusable, make sure you launder them properly. So don't wear the same mask for 3 weeks or 4 weeks on end. Make sure you launder them. Thank you very much.
Thank you, Dr. Black, for your report today. Next, we will hear from the Director of the Southwest Georgia District of the Department of Public Health, Dr. Charles Ruiz.
I'm sorry, I was checking on the slides. Good afternoon, everyone. Good morning, rather. The first thing I want to talk about today is the issue of quarantining. Quarantining can be a very frustrating experience when you're asked to stay home for 14 days or even longer, and I understand that. Some folks have been puzzled by the fact that public health requires people to stay on the quarantine status even if they have a negative test for COVID-19. And so I would like to address that situation for just a few minutes to help kind of clarify the reason why we take this position. So if a person who has never been exposed to COVID-19 is exposed today, our concern is that over the next 14 days, that individual may develop the infection themselves and then be contagious to others and spread it around the community. So that infection could show up on the 3rd day, the 5th day, the 10th day, or the 14th day. If the exposed person does not develop the infection by day 14, then it is overwhelmingly unlikely that the person will. So day 14 is kind of the benchmark. So if that exposed person has a test early during the quarantine period, and if it's negative, that is good news. It's evidence that the exposed person has not become ill yet. But we're still watching for 14 full days because there is nothing but the passage of time that will tell us if that person will eventually become sick, unless they have a test in the meantime and it shows that they are sick. So it's frustrating, we understand that, but once you have been exposed to a confirmed case of COVID and you go on status of quarantine, it lasts for 14 days past your last exposure. The only way to really come off quarantine is if you become ill yourself and you switch over to isolation status. So that's the state of affairs currently, and unless the CDC changes their position, that's what we will continue to recommend in public health. I would like to talk about testing. Testing is free for COVID-19. It's simple and it's readily available. And we continue to have a mixed experience with people who pre-register. We have asked for a number of weeks now that people who want to get tested, please either call and set up an appointment or go online and make your own appointment. If we can have people to pre-register, it will tell us how many supplies and how many staff members we need on the date of testing. That helps us. If patients will pre-register, it will help you tremendously, because it can cut down the time involved to minutes. We have one site, as I speak right now, in Southwest Georgia that is collecting specimens today. And in this particular location, we have not been very persuasive in asking people to pre-register. Consequently, there's a line with dozens of cars backed up because it's a slow process when we register people on site. If we can get everyone to pre-register, it's going to speed the process up. You'll be in and out in just a matter of minutes. And it's easy to do that. You can call and make an appointment. The number is 229-352-6567, and operators are there Monday through Saturday. Another good way to make your appointment is to go online, and you can type in COVID-19.dph for Department of Public Health, dph.ga.gov. And that's, of course, available 24 hours a day. If you go online, you can see the locations that are available, and you can see the times that are available, and you can make your own selection. If you register in this manner, you can share your email, and it will allow you to have access to your test results. And you will have access as soon as Public Health has access. Lately, we have been getting our test results back in 48 hours or less. This week, we have had several days where we have gotten results back in 24 hours. So that's been a nice change, and it really helps us to do our work in investigating cases, and it helps us to identify contacts a lot quicker that way. So this slide, if you're able to see it, it shows the 9 routine locations that we have in Southwest Georgia: Colquitt County, Decatur, Dougherty, Grady, Lee, Mitchell, Terrell, Thomas, and Worth. And today, for the first time, we have a collection site in Calhoun County. We're sort of piloting that to see how it goes. So again, if you'll pre-register by either calling that number 229-352-6567 or go online, it'll be good for you, and it'll speed things up. Recently, in Dougherty County, we have been tracking the positivity rate for all of the tests that are performed in Dougherty County, no matter whether it's done by Public Health or the hospital or a physician's office. All of those reports are supposed to go to Public Health, so we monitor those, and the rate of positive tests in the last week or so has been around 8.6, and we would love for it to be down below 5, and it was below 5 back in June for a short period of time. But in just a few weeks ago, it was around 10 or 11. So we have made some improvement in the last week or two in Dougherty County. Another measurement that we often look at is we'll go back 14 days and take a look at the number of new cases, and then do the math to find the number of new cases per 100,000 citizens. And so for Dougherty County, over the past 14 days, we have had 214 new cases of COVID-19 per 100,000 population. There again, we would love for that number to be 5 or below. We would love for it to be below 100. 214 is considered high, but again, it's gradually trending in the right direction. And by comparison, most counties in Southwest Georgia are above 200. There are many counties in Georgia that are above 400 or 500. So 214 new cases per 100,000 in the last 14 days is not a great place to be, but relatively speaking, it's better than many counties, and it is moving in the right direction. And I appreciate so much what has been said so far about vaccination for influenza. We talk about that every year, starting about this time. And the flu season typically gets going around October, and it's with us through March. Sometimes we have flu in August and September, and sometimes it will last into April. With this year, we don't know how bad the flu season is going to be. We don't know when it's going to peak or have its worst effect. But one thing for sure is the flu vaccine is going to be readily available to everyone. And unless a person has had a very serious reaction in the past to the vaccination, we all should get the vaccination this year. And we really want to urge the importance of early vaccination this year because we still are dealing with COVID. And I want to ask you to think about this from two different viewpoints. Consider what an early vaccine for the flu will do for you. If you were to wind up having influenza and COVID-19 at the same time, that dramatically increases the chances that you're going to have a bad outcome. There is no law of nature that says that you cannot have two viruses at once. It is entirely possible. We don't want you to have either one of them, but we don't have the vaccine yet for COVID-19. So if you can get that flu vaccine and get it early, then that decreases the chance that you're going to be dealing with two very serious infections at one time. Also, please consider what it will do for the community. We're hopeful that we're going to have a vaccine for COVID-19, and we're hopeful it's going to be available this winter. And at that time, many organizations in the community will be busy administering the vaccine for COVID-19. We would like to be through with the influenza vaccine by the end of this year, so we can focus all of our efforts on COVID-19 vaccination starting as soon as the vaccine is available. If you don't get your flu vaccine and get it early, it's going to really tie up our resources trying to vaccinate people for both infections later on in the season. And then the final thing I want to mention about that is we have said many times that one of the things we really need to avoid is overrunning our hospitals. And we came close to that back in the spring and were able to avoid it. But if we were to wind up with a severe outbreak of influenza and another severe round of COVID-19 at the same time, that would really threaten our hospital's ability to take care of us. So there are just many reasons why we all need to get this flu vaccine, and we need to get it early. Please don't wait till next year, to the winter time to get that vaccine. Go ahead and plan to get it now. In public health, we're expecting our shipments any day, and I'm hoping that by Labor Day, we will have our shipments in and that the vaccine will be available in all of our locations. We'll be sure and put out a press release, and I'll give an update the next time we have one of these press conferences. We hope that the vaccines will be here soon for us. You don't have to get your vaccine through public health. It doesn't matter where you get it. But just make sure you get that flu vaccine for you and your family. We're still in a pandemic with COVID-19. People are still getting sick. Some people are still being hospitalized with serious infections, and some people are still dying. So please do your part to help cut down on the spread of COVID-19.
Thank you so much, Dr. Ruiz, for your report today. We will move now to an update from Dougherty County Coroner, Mr. Michael Fowler.
Good morning. First of all, I want to thank the community for masking up, the ones that have been masking up. I think it's the thing to do, the right thing to do. As Dr. Ruiz and the mayor and the chairman have been saying, the numbers are going down, even the death rate is going down. But I think we can do better. As Dr. Ruiz said, just think about if everyone in Dougherty County masked up for the next 14 days. If everyone masks up for the next 14 days, what change could be made here in Dougherty County? I know you missed the football game, going to some of the functions that we normally go to, but if everybody masked up, because if you just a few people that are masking up, and you still have quite a few that are not masking up, the virus still laying out there. It can be transmitted to someone else. But if everyone masked up, I think it will make a big change in our community. So I want to thank the ones that have been masking up. Many times individuals look at you when you walk in the store with your mask on. I wish I can say that you need to put a mask on too. As Dr. From Phoebe, Dr. Black said, when you put your mask on, you can't just put it on your mouth and still your nose will be out. You got to put it on your mouth and nose. The flu season that he said is coming in soon. And it's going to be a problem, I think, for EMS, the fire department, the law enforcement, and also myself. When we go to a scene, to a cardiac arrest, what we going to do? You don't know the person have the flu, or you don't know they have the virus. So they have some of the same symptoms. So when EMS come in, and the fire department and the police department, and then trying to determine that you have the flu. Because when the flu season come in, it's going to be kind of confusing there. So they need to know how to dress with the PPE or what to do. So as Dr. Ruiz said earlier, the ones that have not been taking the flu shot, you need to take the flu shot this year. Because it's going to be confusing to us as we come into the house, especially on a cardiac arrest, how are we trying to say, in the process, why they're trying to save. The EMS need to know, do I need to be dressed out? Do I need to be gowned up? Because some of the same symptoms are still out there. Again, everyone for the next 14 days, you will make a big change in the community if everyone in Dougherty County masked up. So I would encourage you to mask up if you don't mind. At this present time in Dougherty County, August the 28th, we have 178 deaths, positive deaths here in Dougherty County. From the update from the last time we spoke 2 weeks ago, in the region, I say in zone 31721, we have 22 deaths. 31707, we have 35 deaths. On the east side, 31705, we have 41 deaths. 31701, we have a total of 80 deaths in South Albany. Since the last meeting, the presentation, we have 3 more females that have passed. We was at 102, now we're at 105. Males, we had 2 more deaths, there's a total of 73. Based on race, we have 2 more white, there's a total of 37. Blacks, we have 140. We still just have 1 Latino. Based on race and gender, we have 2 more white females, a total of 28. We have no more males and still just at 10. Black females, we have 1 more, that's a total of 76 black females. We have 2 more males, black males, a total of 63 black males. The colors that change, we have, I'll break it down. In the age of 20, we still have 2. Age of 30, we have 3. The age of 40, we still have 11. We have 1 more change in the age of 50, we have 11 total now. Age of 60, we still have 50. Age of 70, have changed to 47. Age of 80, have changed to 38. Age of 90 is still at 15. Over 100 is still 1. As we said earlier, have changed tremendously from what it was in March and April. You look at June, when we started by doing press conference, the first week we had just 1 death that week. June the 7th through the 13th, we had 1 death. June the 14th through the 20th, we had 3 deaths. June the 21st through the 27th, we had 0 deaths. So the death is declining based on, I think, what we're doing, wearing masks and practicing social distancing. July the 28th through the 4th, we had 1 death, and after the 4th of July, it went up to 4. July the 12th, we had 2. And July the 19th through the 25th, we went up to 5. And we have dropped back down now from July the 26th to the August the 1st, we had 2. The next week, August the 2nd, we had 2. August the 9th through the 15th, we had 2. Last week, we just had 1 death. And this week, we've had 2 deaths from the 23rd to now. We have just 2 deaths. And the deaths are not happening in the residents. I want to thank the public for when you find out that you have symptoms, you are going to the hospital. They're not dying in the residence now. That's one good thing. They are going to the hospital. They're dying in the hospital or dying in a liver facility, but they're not dying at home now. That's one good thing. March, again, we had 39 deaths. April, we had 86 deaths. May, we had 26 deaths. June, we had 6 deaths. July, we had 12 deaths. We went up a little bit. So far in August, we just have a total of 9 deaths. Like I said, the death rate have declined tremendously. I want to encourage you again, get the flu shot. I want to encourage you, mask up. If we can mask up for the next 14 days, what changes would happen here in Dougherty County? I want to thank you again.
Thank you, Mr. Fowler, for your update today. We will now open up for any questions at this time. Pause for questions. Okay. Well, please join us here for our next press conference. We've moved to every other week now, so we will not have a press conference briefing on next Friday. We will return to this podium on September 11th for our press conference, first one there in September at 10 a.m. We would also remind you to mask up. Albany, mask up, Dougherty County. This concludes our press conference for today. Thank you.